Oops! Did you see her dentures fall out? Why do you think this happened? It probably happened because her dentures are too loose. No, this does not mean she has bigger dentures. This is commonly seen in older persons as the jaw changes in size and shape continuously. This phenomenon of diminishing quantity and quality of the residual alveolar ridge after the teeth are extracted is known as residual ridge resorption. These old dentures eventually become so loose due to residual alveolar ridge resorption that they end up becoming non-usable after a point. Now, this time varies from patient to patient and is governed by several factors such as hormones, environment, disuse atrophy, nutrition, trauma, or inflammation. Let us elaborate. Hormones such as parathyroid hormone, thyroid hormone, calcitonin, estrogen, growth hormone, and glucocorticoids regulate serum calcium levels in the body and are responsible for regulating bone apposition and resorption. The second factor is the environment, which primarily constitutes the amount of stress and strain on bone, tendons, and muscles associated with bone, and also dictates the speed of bone resorption. For instance, if the residual alveolar ridge is continuously under pressure or strain due to a faulty or ill-fitting denture, the rate of bone resorption will be faster. Now let's move on to the third factor, that is disuse atrophy. It occurs in the edentulous mouth, whether a denture is worn or not. The primary function of bone is to hold the tooth. Once the tooth is lost, the basic function of our jawbone is lost, leading to disuse atrophy. The fourth factor is poor nutrition. Let us take the example of an adult with intact, healthy teeth who can eat anything he wants and has a wide spectrum of nutritious food to choose from. On the other hand, an adult of the same age with no teeth, some teeth, diseased teeth, or dentures will have to choose a soft diet or easily chewable food groups that most commonly comprise of carbs. Who do you think will have a balanced diet? The fifth and final factor is trauma and/or inflammation. When a tooth is lost due to these two causes, the number of bone-eating cells or osteoclasts is higher in that region, making the area prone to rapid bone loss. How does residual ridge resorption happen? The bone consists of several cells which perform various functions of their own. The cells that are primarily responsible for residual alveolar ridge are osteoclasts or the bone resorbing cells and osteoblasts or the bone-forming and depositing cells. Now let's understand how these two cells work together in bone remodeling. Osteoclasts, which are multinucleated giant cells, attach themselves to the bone surface. They have multiple folds in their plasma membrane that form the ruffled border at the sealing zone. What is the sealing zone, you ask? This is the area of attachment of the osteoclast to the mineralized bone, where resorption takes place by enzymes like cathepsin K. Osteoclasts resorb bone by acidification and proteolysis of the bone matrix and hydroxyapatite crystals. Osteoblasts migrate to the site of resorption and lay down new bone matrix, which then matures and calcifies into new bone. We hope you have understood the process of bone remodeling. Here's a fun fact for you. Did you know the trabecular bone undergoes greater resorption due to a higher surface to volume ratio? So the next time you meet someone wearing dentures, observe the shape of their jaw. You will notice that in most of them, the mandible is bigger than the maxilla. An easy way to remember this is by keeping in mind that the maxilla undergoes a centripetal pattern of bone resorption, that is, towards the center. And the mandible undergoes a centrifugal pattern of bone resorption, that is, away from the center. Now let's move on to the classification of residual alveolar ridge resorption based on the severity, as per Atwood in 1971. Feel free to take a screenshot. Order 1, pre-extraction. Order 2, post-extraction. Order 3, high well-rounded. Order 4, knife edge. Order 5, low, well-rounded. Order 6, depressed. Classifying the residual alveolar ridge simplifies interpersonal communication, treatment planning, intensity of disease progression, and prognosis. In our next video, we will discuss this further along with the treatment plans. We hope you had fun learning with us.